Hello, my name is Chloe Yang, and today I will be presenting my GTISM product proposal. So before we dive in, I believe it is important to address just exactly what stress is. According to the Merriam-Webster dictionary, stress is a physical, chemical, or emotional factor that causes bodily or mental tension. It plays a vital and often positive role in our lives. In fact, Daniela Koffer, a researcher at UC Berkeley, found that short-term stress can actually enhance performance, boost memory, and improve alertness. However, it is important to ask the question, what happens if we have too much stress for a long period of time? High amounts of stress for extended periods of time can result in chronic stress. According to the American Psychological Association, chronic stress is a response to emotional pressure suffered for a prolonged time in which an individual perceives that he or she has little or no control. Excessive chronic stress, which is prolonged and constant, can be physically and mentally debilitating. Chronic stress is common in many adolescents today, who are faced with the pressure to be perfect and to outperform their peers in school and in extracurricular activities. Consequently, many teens developed physical illnesses such as eating disorders, insomnia or fatigue, and mental illnesses like depression. These conditions often push adolescents to harm themselves or to commit suicide. According to the Center for Disease Control, 13.5% of adolescent deaths can be attributed to suicide, and this is one of the highest suicide rates among adolescents in the world. There are solutions that exist today to help individuals struggling with chronic stress, the first of which is psychotherapy, the most common treatment tool used for patients suffering from stress or depression. Psychotherapy is a personalized therapy session that allows for the patient to talk about their problems while a psychiatrist or therapist helps them make connections and find solutions. This method has shortcomings because it can be expensive. Additionally, opening up to a stranger about intimate details can feel uncomfortable or natural, so many refrain from truly opening up to a therapist or a psychiatrist. The second existing solution is medication. Prescribed medicines can help with side effects of mental disorders caused by stress, as they balance out the neurotransmitters in the brain that impact mood and emotions. However, they are also very expensive. Many individuals may find it difficult to regularly purchase and take such medications. Additionally, medications for mental illnesses caused by stress can often have adverse health effects. In essence, the side effects of antidepressants and other medications can have a larger negative impact than the disease that they are trying to heal. So, what can be done about this pervasive issue? This is where my solution comes in. I have developed a solution that addresses the dearth of support for those with mental illnesses and educates teenagers about stress and how to handle it. My product is a school-wide program called Destress. This program, which mimics a psychiatric session, is a monthly informative session that also gives a small group of students a safe environment in which they can speak to their friends or counselors without judgment. Destress targets high-performing students taking AP classes that are most susceptible to chronic stress and its ramifications. Each session will be an interactive lecture about stress management, and students will be able to share their experiences with the topic that is being discussed, creating an environment in which students can advise one another. A school counselor will be present at each meeting in order to meet with students that might need help and to fuel discussion during the seminars. So, why is this program better than existing solutions, and what does it have to offer? Well, firstly, Destress makes psychiatric help more readily accessible to teenagers that are at high risk for chronic stress without the high costs. Secondly, it creates a supportive network for students to share their struggles or concerns. And thirdly, the group setting makes it possible for students to help their peers by sharing their own ideas or experiences and creating a productive and constructive environment for students to gain inspiration for their own lives. Now, a quick disclaimer. Stress is a constant force in our lives, and it cannot be totally eradicated or destroyed. My product is by no means a panacea for chronic stress. However, we should, as a community, create outlets and spaces for self-expression so that individuals can express their struggles rather than internalizing them. And I believe that this is exactly what my product does. It creates a space in which adolescents can de-stress. I hope you enjoyed hearing about my vision for this project and a solution for chronic stress. Thank you very much for listening.